This is an anatomy quiz on transverse cut section of right leg superior view. Identify the questioned muscle. This muscle is tibialis posterior. It's a centrally placed muscle in the leg. Identify the questioned muscle. This muscle is tibialis anterior. It exhibits a multipennate, specifically, a combination of circumpennate and unipennate arrangement of muscle fibers. Identify the questioned muscle. This muscle is flexor hallucis longus. Important point about this muscle is, it arises from lateral bone in the leg and inserts into the medial-most toe of foot. Identify the questioned muscle. These are two heads of gastrocnemius muscle. It helps to speed up your pace while running. It acts like the top gears of your car. Identify the questioned muscle. This muscle is extensor digitorum longus. It is a pennate muscle in the anterior compartment of the leg. Identify the questioned muscle. This muscle is flexor digitorum longus. Important point about this muscle is, it arises from the medial bone of leg and inserts onto the lateral toes of foot. So, the tendons of two long flexors of foot cross each other below the spring ligament. Tendon of FDL crosses from medial to lateral side below the tendon of FHL. This is called the knot of Henry, thereby reinforcing the strength of spring ligament and helping to maintain the longitudinal arch. Identify the questioned muscle. This is plantaris muscle, a small, vestigial muscle, featuring a short belly and a very long, slender tendon often called the freshman's nerve. Identify the questioned muscle. This muscle is soleus, often referred as a peripheral heart. It has venous sinusoids filled with venous blood. It communicates with the indirect perforator veins, helps in anti-gravity return of blood to the heart. The soleus is the most effective muscle for plantar flexion in a bent knee position. It acts as a first gear while running, helps you to push your body off the ground. Identify the questioned muscle. This muscle is peroneus longus or fibularis longus. It helps in maintaining the posterior transverse arch of foot, forming a sling along with tibialis anterior. Identify the questioned muscle. This is peroneus brevis or fibularis brevis muscle. It is critical for ankle stability and frequently injured in ankle sprains. Identify the questioned muscle. This muscle is extensor hallucis longus, powerful extensor of greater toe. Dorsalis pedis artery is palpated lateral to the tendon of this muscle, over the intermediate cuneiform bone. Identify the questioned artery. This is posterior tibial artery, the continuation of popliteal artery in the back of leg. Identify the questioned artery. This artery is anterior tibial artery. It is a minor terminal branch of popliteal artery, in the front of leg. Identify the questioned artery. This is fibula or peroneal artery, a lateral branch of posterior tibial artery in the back of leg. Identify the questioned nerve. This is superficial peroneal nerve, motor nerve supply for the lateral compartment of leg. Common peroneal nerve after giving out its recurrent genicular branch or articular branch. Splits into its two terminal branches, a superficial and a deep branch. Identify the questioned nerve. This is deep fibular nerve or deep peroneal nerve, the motor nerve supply of the front of leg and dorsum of foot. Identify the questioned nerve. This is tibial nerve, a terminal branch of sciatic nerve in the back of leg. Tibial nerve runs on the surface of tibialis posterior muscle in the back of leg. Identify the questioned structure. This is interosseous membrane between tibia and fibula. This compartmentalizes the leg into anterior and posterior compartments. This also forms an intermediate tibio-fibular joint called syndesmosis. Identify the questioned structure. This is the deep fascia of leg, also called crural fascia. It has a major role in anti-gravity venous return from the leg. It prevents the outwards bulging of the muscles during contractions, thereby reinforcing pressure upon the deep veins. Identify the questioned vein. This is the great saphenous vein, the longest superficial vein in the body, running along the entire inner length of the lower limb from the foot to the groin. Identify the questioned vein. This is the small saphenous vein, formerly known as the short saphenous vein. It is a superficial vein in the posterior leg that drains the lateral foot and calf, typically emptying into the popliteal vein. Identify the questioned nerve. This is sural nerve. It is purely sensory nerve in the lower leg that provides sensation to the posterolateral distal leg, lateral ankle, and foot. Sural nerve is formed by the union of the medial sural cutaneous nerve, a branch of the tibial nerve, and the lateral sural cutaneous nerve, a branch of the common fibula or common peroneal nerve. Identify the questioned nerve. This is saphenous nerve, the longest cutaneous nerve of the human body, responsible for providing sensation to the skin on the medial side of the knee, lower leg, and foot. It is a branch of posterior division of femoral nerve. Identify the questioned structure. These are venous sinuses in the soleus muscle. These are thin-walled, valvulus, and highly distensible reservoirs located deep within the calf muscle. These sinuses store venous blood during rest and rapidly expel it into the deep veins during contraction of soleus. Find out the two muscles of leg missing in this diagram. One is popliteus, and the other one is peroneus tertius. Popliteus is missing because it can be seen only in the upper one-third of back of leg. Peroneus tertius is missing because it can be seen only in the lower one-third of front of leg. This diagram, as you know, is a transverse cut section of mid of leg. Now the question is, which side leg is this? And, from which direction are you looking at it? So guys, the interesting point about this diagram is that you can study it in two ways. Either you consider it to be a diagram of cut section of right leg and you are looking at it from above. Or you consider it to be a diagram of cut section of left leg and you are looking at it from below.